guys. Uh, just wanted to, I guess, touch basis and kind of tell you what's going on. Um, my therapy sessions have been doing really good. You know, the physical therapy for my back. Um, my knee has been kind of bugging me lately, and that actually is what's hurting me today. But each day I'm able to do a little bit more physical therapy, and uh, was just doing just the pool, and now I'm actually getting out of the pool and doing the exercise bike and doing some crunches and stuff like that. But now my knee is starting to, the inside of my left knee is starting to bug me, and I'm not sure, what it is or how to fix it. But my doctor says that it doesn't. It could be related to my back, but it's not my back that's causing it. Meaning that like the nerves or the muscles or something in my back is causing my knee to start hurting. But it could be that I was compensating for 7 years limping and that sort of thing, so it caused some tissue or muscle damage in my knee, or I could have something else that's going on because I've never really injured my knee really bad ever. Maybe playing basketball way back in the day, I hyperextended it, but nothing that put me out for more than a day or two. So the doctor prescribed, wrote an order with my back to have my knee kind of go through some physical therapy too, because I'll be laying at night on my bed and all of a sudden it just like a sharp, high pitched pain is on the side of my left knee on the inside. So, but my back is doing really good. It's healing up really good. I do get, at night, like yesterday, we went to the big game, a Super Bowl party over at my buddy's house, and I did really good for like the first 2.5 hours, and then it just started tightening up and getting stiff, and I started getting really tired, and I have to sit in a certain chair. I couldn't sit on the couch because I have to sit upright and not back like I am right now. But I just get really tired, and my body just gets really tired, and when they shifted me up, when they put that spacer in there, they shifted me a half inch. So I've actually noticed some of my pants are a half inch shorter than what they used to be. And I thought it would just be in my torso where I actually gained that height, but it's actually in my waist too, because that's where L5S1 is, right in your waist. So some of my pants are a little bit too short to wear now, which kind of sucks because I usually wear, like a 34, 36, 34. And some of them I had to wear 32s. They're a little bit longer cut than normal, but now those 32s look like a 30. So I think that I, gained some length in my legs too. Not much, but I notice it. Um, um, I got, I don't know if you guys watched the video that I posted before this, but I got to go down and see my cousin down in Utah. He's from California actually, but he came up to Idaho and then he went down to Utah, and he decided to ride a bull for the first time. And my cousin Matt used to ride bulls professionally for 15 years, and he actually just retired last year. And I never got the chance to watch him ride except for a couple videos that he showed me. But I got to spend some time with some of my family, and that was fun. The drive down there was okay, but I think by the next day and going to that event and everything, just walking around and sitting in bleachers and that sort of thing, um, and driving home, it killed me. I was really tired when I got home, for a day or two. But I'm headed back down to Utah on Friday actually to go watch the Bulls and Jazz game with my younger brother Stan. He's a big Bulls fan, and um, so they're playing the Jazz down in Utah, so we're gonna go watch that game. Um, so I'll probably post some videos from that too. But I'm doing good. My scar is actually healing up pretty good. There's some days that it kind of itches a little bit and it gets kind of tender. Um, but they tell you to massage your scar a little bit and put vitamin E oil on it so it doesn't scar as bad. I don't care about that. I mean, it's on my back. I can't see it anyway. But some people are. I have a buddy that likes to call me Cracker because he says it looks like my butt crack goes halfway up my back. And I don't really care. Um, I think the number one thing about this whole back surgery thing is just try to keep a positive attitude. and be positive about everything, and believe in yourself, and never give up. Because if you give up, back pain is a really big cause for obesity. I mean, if you hurt your back, that hurts your whole body. It's hard to move. It's hard to do anything. It's hard to even get out of bed for me some days, and it's just, you have to self motivate yourself. You have to, because if you don't, you're not going to get up. So I think that pushing yourself to get up and move on. Hopefully I go back to work here in about a week. I mean, my surgery was on December 12th, and it's February 4th, the day after the big game. Is it the 5th? I don't know. Anyways, so, and I want to go back to work. If it's part-time, it's part-time, but it's been a goal for me to lose weight, to get back to work, and be back to normal, basically. I know it's going to be a struggle in the next year or so, because it takes time to heal. And that's what my doctor tells me, and that's what everybody tells me, all the physical therapists, physical terrorists. It just takes a long time to heal, and it does. So if you're getting ready to have this surgery, just keep in mind that it is not something you're going to have the surgery and then 6 weeks later you're going to be fine. It's a long, drug out process, and it just takes so much time to heal. Your body is going to be in shock. Your back is like the foundation of who you are as a person and what you can do, and your mobility, and sometimes your mood. I mean, taking these medications, sometimes they can alter your mood. I ran out of my painkiller, and I thought that I could go a half a day, and I did, but it just starts eating at you, and the pain starts hurting, and it puts you down. And pain can just take everything away from you. So don't be afraid to take your medications, as long as you don't take too much. Get plenty of rest, stretch, and make your muscles long, because it just helps the healing process. Do what your physical therapist says. Do what your doctor says. Don't overdo it. You might think, okay, I'm going to ride the bicycle for another 5 minutes today. Just be prepared that every time you do something a little bit extra, it's going to hurt just a little bit extra more. Doesn't make any sense, but it's kind of funny actually when I said it. But just be prepared for a long recovery. It's not something that's just going to change like that. I mean, I thought that I could go have this surgery because I've been hurting for 7 years, and have this surgery, and everything's going to be a lot better. Well, it's not. It's actually a step back, because waiting to have the surgery, you always question, is this going to be what I want? Is this going to be better for me in the long run? Is this going to help my back out, and help my family out, and help my job out, help everything out if I have the surgery right now? And I doubted that. Even when I had the surgery, I was like, okay, is this really the time? Should I be doing this? And now I realize it was, but it's such an eye-opener not knowing what the recovery process is, or how much it's going to affect the rest of my life. Because I'm not going to be able to play basketball full bore, I used to play... I gotta get up. I used to play city league basketball. I used to go and play with the buddies at the church, for 2.5 hours every Tuesday night, I can still go do those things. I'm not going to be able to play competitively, but I'm going to be able to shoot a hoop. But jumping and running constantly right now, there's no way. I went to my daughter's basketball practices and kind of helped that a little bit, and I can shoot and I can rebound. But if I try to run or try to do something too quick, my body just does not allow it, and I get really tired when I get home. So just be prepared to know that it is a long recovery process. It is going to limit your mobility. Doctor says it takes a full year to fully recover your body to not be in shock anymore. So, and it's true. I mean, I'm only a couple months out, and I'm doing really good. But at the same time, I know that there's lots of physical limitations. I used to snowboard like crazy. That's how I originally hurt my back, and I don't think I'm ever going to be able to do that again. If I do, it's going to be, not full bore, because if I wreck and get twisted, and there's a lot of hardware in me now, so I have to be careful. So just be careful, have a positive attitude,
change your lifestyle a little bit, and you'll be fine. There you go. Have a good day. Goodbye.
Bye bye.